'Twas the night before Christmas, and all through the land, every GP was working, even a GP at hand. The vaccines were put away by the nurses with care, with the hopes that they wouldn't be needed next year. The children all snug, all nestled in their beds, while visions of TickTok danced in their heads. Mom with washed hands and dads covered in gel, as everyone settled down for the Christmas by Teams hell. When my phone on the placemat started buzzing with such a jitter, it must be something breaking on that there Twitter. Away to the desk I flew in a flash, grabbing my phone to check on the latest Dr. Bash. Omicron spread across the land like wildfire, despite vaccination efforts everywhere, including the Shire. Christmas parties all cancelled until we don't know when. Hold on, is that party music I hear coming from number 10? The news of ambulance queues fills my timeline. Hospitals all overflowing following the latest NHS redesign. Our hospitals buckle, their staff must be tired and battered. I think of the district nurses and the pharmacist who must also be shattered. When what to my wondering eyes should I foresee but the latest comments about the lazy GP? As a lone working doc, still at the practice this night, trying to clear the work and get it all right, using every system around to answer the demand question. Here are their names. Who gets a mention? On Accurix or eConsult? Or is it Engage Consult? Do I use EMIS or MJOG? But I want Exxon. Still, loads of DocMan, but not on System 1. Praise for Ardens, Eva and Primary Care IT. Do I need to think about clinic? Or ask my GP? Patients know best when doctors care anywhere. Livy is around, even with push doctor everywhere. But whichever system I use, I'm still here, always late, wondering how did healthcare get into this state? With failed promises of 6,000 additional GPs, an underfunded system, and bureaucratic monitoring, such as CQC. It's no wonder that general practice is under such pressure. If this carries on, I'll be going out in a stretcher. I'll leave a message for another patient. Another missed call, as the media replies demanding face-to-face appointments, face-to-face for all. The health secretary comes on to the news, demanding that patients should see GPs how they choose. The BMA and the RCGP speak up and shout, with some GPs wondering if they've got any clout. I ponder the question of the PCN DES, wondering if I can believe anything that NHS England says. That the workforce will help and change primary care? Well, for some, they have been doing more than their fair share, with various roles of wellbeing coaches, physicians associates and pharmacists, social link workers, paramedics and physiotherapists. A few more roles add extra support, but it seems that our workforce will always be short. We need more people for primary care to last, but to find innovative ways, listen to the General Practice podcast. My eyes are getting tired at the screen as I glare, wondering if this is the business of healthcare. An email pings up, the tax deadline is here. Oh, it's not funny. I better check out the latest on Medic's money. Another alert pops up reminding me of my appraisal. It's enough to make anyone feel unstable. Which platform is the easiest to use? Clarity, 14 Fish, or GP Tools? To keep up to date, I might need to become more radical, like a face-to-face course by Rora Med, Red Whale, or MB Medical. But then an idea comes into my head from the Flying Doctors and Zog. Wait! Stop it! Leave work! You're not a frog! And then with the knocking I heard at the door, who on earth is still here? I'm not sure. As I turned my head around far too quick, I saw standing there the practice manager, Nick. Nick was all dressed in fake fur from head to foot, and her clothes were all tarnished with dust, and she looked kaput. A printer carried in the crook of her arm, and she gave me a look that threatened harm. She said, "It's 8 p.m. on this snowy Christmas Eve. It's time to go home. You need to leave." I tried to object. Why? I don't know. But Nick made it clear it was time to go, go, go. I switched off the computer and turned down the lights, wondering if anyone can get this job right. I dusted my car off from all of the snow as Nick drove past with a shimmering glow. Then I heard Nick exclaim as she drove out of sight, "Happy Christmas to our NHS and to all. A good night."